I looked all over the internet and I just can't find anything that gives you the simple steps to take a personal injury case step by step to your settlement. And this is just for the consumers and for patients to learn the steps in personal injury. Hey, Dr. Tony here, 41 years in the personal injury field as an acting practitioner and now an educator, as we go through these simple steps for the consumer and the patient. It has nothing to do with any legal or attorney's representation. We want you to learn yourself how to do personal injury. And I might use this whiteboard and I might not, but this is so simple that I'm going to walk you through with our personal injury elite little course here and into steps. So the first thing you want to know is unfortunately, there's accidents, and you are involved in accidents here and there, your family, your friends, and now you need to go through the steps in maybe a personal injury case. First of all, you never say sue. You're not suing anybody. You are taking rights, the rights you have that other people pay for to protect your car and your injuries, and also ourselves. So make sure that the word sue is not involved, but your rights as a consumer or a patient. So the first thing you're going to do is get any information back and forth in the accident scene, be safe and get off the road. And of course, there might be a police responder coming to you and get the police report. So that will happen at the onset of the accident. Of course, go to your emergency rooms or any of the urgent cares if you need to real quickly in major accidents and injuries. But after that, you're going to probably see a primary physician, chiropractic physician, or your MD after the accident. So the accident's going to happen, and the doctors are going to take you in on what they call a lien. A lien is basically holding the account for the case or the insurance third party at fault that can cover the health costs, services, and your car damages. And your car damages are probably going to be the fastest to be settled, where the health injuries can take a little longer. And I know a lot of states it's up to 5 years they can take to settle a claim, so that could be the longest. That's called a third party liability. The person's at fault. Every state has different qualifications. You could be in a no-fault state or a fault state, so you need to find that out. Anyway, the doctor will take you in, examine you, work up a treatment plan if needed. You'll go through the treatment plan with your doctor, and it's most important that he'll have you sign lien forms and authorization forms to get to the third-party adjuster that will handle that claim to make your settlement. Now, you may want to get an attorney if you are involved in more injuries, because an attorney is an educated factor in between your life and to take care of the insurance adjusters as they go along. But to make it real simple, you're in an accident, you have injuries, you go to your doctor, you sign some forms for lien to hold the account on file to be paid when it's settled. You can also use your automobile insurance medical pay you paid for. So you can add those benefits into the health costs to be paid, and also your health insurance in many states can be paid to your doctors also. So there could be basically 3 coverages in this case of an automobile accident. Of course, the third party person at fault is responsible for 100% of the health costs and the car damages. So the doctor will go through your treatment plan. He'll release you under observation, and under that observation, he will then send his medical records, the claim number, and everything to the parties or the attorney that represents you. And during that course, through health costs, they will evaluate the settlement based on the injuries, diagnosis, evaluation tables, and come up with some kind of settlement number. Now, your attorneys are educated, so they know to send a demand for an exact amount, but you as the consumer or the patient can also add a settlement amount to that insurance company. And remember, this insurance company is not yours. This is the other party who is at fault. And they have usually up to $100,000 in liability. But a lot of times, unless your injuries are very, very, very bad, that they settle in between all those amounts based on the health costs. So I wanted to give you the simple steps of a personal injury case to allow you to do your own settling of your case. Obviously, there's many attorneys out there that provide great legal advice, but also you can be your own legal representation to settle your own case based on your injuries and what the doctor's notes say. All right, so let's go through it one more time. I don't think I need the whiteboard. You get in, unfortunately, an accident, you or your family, your friends, you have some injuries, you want to get checked out, go ahead and get them checked out with the doctor of your choice. Make sure you get the information from the other party's insurance. There could be a police report involved with a police responder, and then you move into getting an examination evaluation on your injuries. Doctors will recommend some treatment on the injuries based on the cause. The doctor will treat you in your treatment plan. You follow that thoroughly through, and then when finished, you can go ahead and give them your automobile med pay you paid for and your health insurance you also paid for, and plus the third party who's at fault will have their insurance company paying 100% for the car damage and your health costs also. So the extra benefits possibly that may come in through your paid contracted health insurance coverages can go back to you, or if you choose, back to the insurance company, but it's your choice. So then the doctors will send the medical records and all the claims to the third party or the attorney at the end when you're released under observation, and then they will send a demand on the evaluation tables on where your settlement might be. And from there, it's basically whether you accept it or not and go on, but base it on your quality of life and to make sure you try to get back 100% of where you were before that accident took place in your life. All right, this is Dr. Tony, 41 years personal injury physician of chiropractic sports medicine, and I just wanted to try to bring this out to you on an educational session with the PI Elite Personal Injury Program. Hey, take care and make it happen.